by our chairman, Mr. Irongo Nyakera, and our CEO, Dr. Andrew Mulwa, and other guests. The chair there. The CS are supported by the chairman who will unveil the plaque. And of course, His Excellency, the Governor of Kisumu. Now we will go ahead and unveil the plaque. Thank you very much, Madam CS, Chair, and His Excellency the Governor. Asante sana. Maybe we can go ahead and read.
When the medicine
Kemsa Kisumu Regional Distribution Center.
Kemsa actually meets our demand.
There is no any other supplier who we can match with Kemsa.
Kemsa has a competitive advantage, of course, of delivering to the last mile and delivering quality.
This warehouse
While we began with ensuring that we...
And after that, we serve 19 counties in this particular region. So the CS will cut the ribbon. Thank you very much. Everybody will have a chance to visit the warehouse if we can allow secretaries first of all to go through at house. All the guests are asked to dress up. Dr. Bukachi, if you can help, please come. Please. So we'll go ahead with the program. So, Madam CS, we in the process of picking orders and orders. I will hand over to our Director Operations to be able to explain what you're doing here. Director.
Madam CS, karibu ni wote. System. Start our process with our salespeople. They're on the ground. The collectors are put in the system, and we are able to see. To place the end to pharmacist from all. When they click the LMIS system, exactly what they've ordered. So what you are seeing here, Madam CS, is Vihiga County. Sharon, go back one step. So this shows the overall for Vihiga County, the total debt that they... What? Is 6.7 million is over 210 days, to 60 days, 10 million. The system that we have internally, anything below 5 million doesn't have to go through any approvals. Anything above that, the county, commitment letters, and other mechanisms to follow. Let's see what Vihiga has. We have orders total for pharmaceuticals. We have, for non-farms, we have order of 9.8 million there. Then we are able to generate over 90%. We generated P of 38, no availability, and that's about 82. See, 73 villages in total. Yeah. Yes. So once that is done, customer service will confirm everything and send it across to warehouse. Sent to warehouse. Now need to be processed by facility. So we move on next. That one is still in our system. Yes. 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 You're able to see that? Yes. Yes. Is it? Yes. Back orders. No. Correct. Some counties. Yes. This is yeah. and through I'm seeing yes, Doctor. This is an important point. This is an important. Madam's important point. That facility or what's happening? No, it is. So it's still work in progress, and we are working with it because on the demand factor. So when it comes here, we are now in our house we process by facility. So the order when it comes from a customer service, the 73 facilities, it comes here, it's assigned by facility, by picker. Yes. Yes, yes. So here we have Kegodi Health Center, whatever items, the items they ordered. So we are able to see there what the quantities are available for issue, the ordered quantity, and this is due here quantity. Data quality analysis, basically that's just a check on our end. If let's say the pack changed from 15 pack to 25 pack, it is corrected at that point. But that shows the quantities that are available and what has been ordered. So, and that shows there's quite some products that have been picked. So once that is done, that is, yes, total available in the warehouse. No, yeah, that's 1 gram, yeah, 250. From there, from the warehouse, it is sent to distribution. For distribution, we do route plan using our system to see optimize by facility the shortest route. Now that's how we align our vehicles. So that is done. Then they also are able to pick the vehicles, the right size vehicles, cold chain or trucks and the size. Once that is done, dispatch is done. Then we come to the e-logs. This is electronic.
The medicines improve the confidence in the patient.
Madaktari wako, dawa iko. Sasa nitakomplain tena.
Kemsa actually meets our demand.
There is no any other supplier who we can match with the Kemsa.
Kemsa has a competitive advantage, of course, of delivering to the last mile and delivering quality.
While we began with ensuring that we
just fencing locations.
RDC all these
After we have tracked vehicles,
no, these ones are both.
this one is geofencing locations. Geofencing locations.
That is why Kemsa's strength is on quality and nationality. Our challenge is on the order freedoms and most of our, not all our ills emanate from the COVID circulation. So, in minor, the COVID Kemsa was a premium. And that's why we're taking it back.
This list. So you looks like you need some lump sum support to get you out of that.
Yes. We left 7.8 billion. The 2B is a removes us from HDU to ordinary ward.
But you're still sick.
Yes.
You can survive in the ordinary.
Yes.
I'm
We can get our way out.
This is a check. So this is at the picking point.
Yes.
So we generate a picking list with items, and it's assigned to somebody. So this is the list. So they pick, then they have to also cross-check.
And the ones which have not been checked, meaning
That one,
like paracetamol is not checked.
you can see like this is IV. So this what is ticked is for this box. Then these ones being bulky, they are not part of this, so they will come. So this is work in progress.
Somebody's still picking.
Yes. Madam Chair, these are code rooms.
We support the National Vaccination Program. We most of our so this is NVIP, the National Vaccine Program. So after Kitengela and Nairobi, we integrate here, Mombasa.
So the program picks from here?
Yes.
Why do you say we support? Who should do it? Does that sound like you are doing an MFA?
We have a vaccine supply chain system, which is outside the country.
Who finances it?
The ministry.
So when you say support, you are supporting the ministry outside.
Yes, yes, because it is not your
because you see, Waziri, you've just done the BPS. These are the issues that you come in to the BPS, so that when we come to the budget, we know that Kemsa is even supporting this.
Yes.
So even if the counties paid them, who pays them for this?
I think, and that's why we have been having this discussion with Waziri, and we also guided that we have a discussion, the PS has been guiding, that we ask ourselves at what point do we combine the two supply chain systems so that we have one national supply chain system. Because currently we are operating two, parallel at national, integrated to going downwards.
The parallel one at the top, who is doing what?
The National Vaccine Program under the ministry runs the national...
Is it the one which used to be called KEPI?
Yes.
That is the Ketengela group.
Yes, Ketengela, yes.
So why can't
the warehouse from
integrate?
The warehouse. They have a warehouse in Nairobi, but when you go down, we have a warehouse.
We have depots in all the old 8 provinces in Kenya. So they all come and Madam, yes, so here, majority of the program of the products are program items. So HIV and malaria. So now we're also doing EMMS. EMMS being the normal medicines, the normal HPTs. And the whole idea is such that when you have single facilities, and even from this region, when everyone is to order onto Nairobi, no matter how efficient they are in Nairobi, it will be difficult. A long queue will form. All 47 counties. County one sub number one, will be another county sub number 47. It's even gets complicated when you get single orders from facilities trying to optimize the road. So this regional distribution center takes care of that. Takes care of that. So this is for this region.
How many counties?
11 counties initially. When we are full as per the world, we'll be able to do 19 counties.
We plan to expand the area for expansion.
Yeah, so this is just area for expansion.
So, in our
so that
but the counties are already decided. The counties by region are already decided.
So unfortunately the soil is a little bit soggy, so we just have to go back this way.
That's the only reason we are going back.
Because CS will have a truck passing through here.
Excuse my ignorance. I'm the last of
Investor.
Just about to come in now. So once they come in, we should all be upstanding. Thank you. So our chief guest is here, so we should all be upstanding. Thank you. Madam CS, you're most welcome. Okay, thank you very much. Thank you very much. You may be seated. So at this particular moment, I want to invite the representative of the Grace Bishop of Maseno South. That is the Reverend Bethwell Rogo. Reverend Rogo, to pray for us. Reverend Rogo. Oh, there he comes. Sorry.
Let us bow for a word of prayer. Almighty God, our Heavenly Father, we thank you for the gift of this day, for the launch of Kemsa Regional Distribution Center. Thank you for your servants who've come to officiate and facilitate this. We thank you for them. We thank you most sincerely for the county of Kisumu and the leadership, especially the governor, who will be hosting this facility on behalf of the region. May his leadership and the rest who will be working here be of service to the community in this region. Bless this function, guide it through the power of your Holy Spirit, that all may be done to the glory and honor of your name and to the service of the people of this region. This I pray in Jesus' name. Amen.
Thank you, Reverend Rogo. We will go straight away to the national anthem. Unfortunately, we had power surge, and the band had arranged to do the national anthem, but nonetheless, we will have it streamed. So we will all be upstanding and sing the national anthem together.
O God of all creation, blessed is your incarnation. Justice in our shield and defender. May we dwell in unity, peace and liberty. Plenty be found within our borders. Mungu twaomba uilinde Jumuiya Afrika Mashariki, tuwezeshe kuishi kwa amani, tutimize na malengo yetu. Jumuiya yetu sote tuilinde, tuajibike, tuimarike. Umoja wetu ni nguzo yetu, idumu jumuiya yetu.
I'll be working alongside the protocol officer of the governor of Kisumu, Mr. Madanji. So, Mr. Mandaji, if you could come near me. Having said that, Madam CS, we want to thank you for finding time to be with us. And other dignitaries, we have quite a number of dignitaries, governors, deputy governors. We have members of parliament, members of the National Assembly, of course, and the Senate. We have deputy governors, I mentioned that. We do have CCs, we do have chairmen of parastatals. We have our honorable chairperson of Kemsa board. We have the CEO of Kemsa, we have other CEOs, we have other government officers, including representative of the County Commissioner of Kisumu. Madam CS, you taught us one thing, that delivering as one is the main thing to do. And us as Kemsa, we've been working with many other partners, other government agencies, including the county governments. So we are representatives from different sectors and different departments, different counties, and we thank you all for finding time to be with us. So from here, I want to invite Madaji to take over the program so that he can carry on and invite the next speaker. Thank you.
Thank you very much. A very good morning once again. All protocol observed. Allow me now to proceed with the program with my co-MC. I want to invite on board Dr. Andrew Mulwa, the CEO, just to come over, make recognitions, and make few remarks.
Thank you very much. Our chief guest, the Cabinet Secretary for Health, Honorable Nakumicha Susan Wafula, Excellencies, governors who are here, Governor Watichilo, and the Deputy Governor for Kisumu, the Chair of the National Assembly Health Committee, representatives of the Senate Health Committee, honorable members of Parliament who are here, the Chair of Kemsa Board of Directors, directors of the Board of Kemsa, CEOs from various institutions who are here, representatives of the county health management teams led by the CECs for health, their chief officers, directors, CEOs of various organizations and MedSups of various facilities that we work with, our CHVs, ladies and gentlemen, good morning. Good morning once more. I want to take this opportunity on behalf of the Kemsa family to thank you for joining us today in this auspicious occasion when we are celebrating a huge milestone in delivery of our mandate to the people of Kenya. Today's event is not just launch of a regional distribution center. Today's event is a launch of efficient and more responsive delivery of drugs and health commodities to our patients in shorter times, in improving our turnaround time in terms of having shorter turnaround time, and again, improving our collaboration with counties. Waziri, devolution is one of the tenets of our 2010 constitution. Kemsa, while we remain a national organization, our functions are tied to the devolved health system. And for Kemsa to be responsive to the needs of the people of Kenya, we have, in essence, to devolve ourselves. This is one step towards that, ensuring that we don't just work collaboratively with the counties, but we also assimilate our operations to the county needs. With that, I am so glad today, and I'm sure the Kemsa family is excited to see this day come to pass. Madam Waziri, when we came here in July last year, and the board directed that the Kisumu Regional Distribution Center should be operational. It was actually in August. It should be operational by December. It looked like a very tall order, because where we are standing here, there was no cabro, there was no gate, it was like an abandoned warehouse. But Waziri, 6 months or less down the line, we are here to celebrate not just the physical infrastructure, but the operational infrastructure to deliver a regional distribution center that will serve counties around the Lake region from this point. This will ensure that patients get what they require within a shorter time. And that can never be a better joy for me and the Kemsa family than delivering what we are supposed to do in the best way that we can. Having made those remarks, CS, I would like to invite the Kemsa team. We are joined by, we are about 500 of us. We could not all of us travel, but I'm sure wherever the rest of the teams are, they would really have come to celebrate this milestone, but we chose team members to represent the rest of the team. So wherever you are, Kemsa team, be upstanding to be recognized. Kemsa family, tuwapigieni makofi jameni. Thank you very much. We have directors, we have managers, and we have officers who we have been working with to make this dream a reality. Some of the team members, Waziri, have had to make numerous travels to this place to ensure that the contractual work that were being undertaken and also the operations of this place is complete by today. In fact, so to speak, Waziri, there are some who I can see who did not sleep last night because they had to make sure that everything is 100% operational. Thank you very much, team. I also want to take this opportunity to recognize our colleagues from other parastatals, our colleagues CEOs who are here. I can see Dr. Dagane, the CEO. Maybe the CEOs can come and introduce themselves. Kujeni CEOs. I can see Dr. Shikuku. I can see, and their representative. Kindly come. Kindly come forward. Just 1 minute.
Good morning. Good morning once again. My name is Ahmed Dagane. I'm the CEO of Kenyatta University Teaching, Referral and Research Hospital, KUTRH in short. Thank you.
Waziri and all guests present, good morning. My name is Dr. Richard Lesiampe, CEO, JOTRH.
All protocol observed. My names are Dr. Kibet Shikuku from National Spinal Injury Referral Hospital. Asante.
Good morning to Waziri and all the guests present. My name is Wycliffe Ochiaga, the Managing Director for Lake Basin Development Authority. Thank you.
Good morning, Waziri. all protocols observed. My name is Edwin Kimtai. I stand in for the CEO National Syndemic Disease Control Council, who was not able to come.
Our CS and all the guests, my name is Lucy Chebungei, Deputy Director, Finance Administration, KMTC, representing the CEO.
Good morning. My name is Edward Maina, representing the DG Kemri. Thank you.
Good morning, Madam Waziri. My name is Dr. Elijah Terer, CEO, AIC Litain Mission Hospital, Kericho County. Thank you and God bless you.
Thank you. Tuwapigieni makofi jameni. You've seen we are fully supported by the parastatals that we work with in the ministry and others who we collaborate with, like the Lake region. Waziri, with your permission, let me also introduce our soldiers in the delivery of healthcare system as directed by yourself and as guided by the President and the Kenya Kwanza Manifesto, that primary healthcare is the means to deliver universal healthcare. And I want to introduce the CHPs who have joined us today because they are the front line of our health delivery system. The CHPs who are here, may you be upstanding for you to be recognized. Tuwapigieni makofi jameni. Hawa ndio askari wetu wa afya. Asanteni. With those introductions, I think I have covered my part, Waziri. I will now want to take this opportunity to invite Dr. Ganda, the CEC for Kisumu, who will in turn introduce the county CECs and the county CHMTs that are represented here. Karibu, Waziri. Tumpigieni makofi jameni.
Our chief guest is the problem of heights. Our chief guest, Madam Nakumisha, governors present, Governor Otichilo, and our deputy governor, Dr. Willie. Allow me to ride on all the previous protocols because I love to name all the people, including the MPs who are present and the chair of the health committee, Kemsa board, and all those. So I think mine is very simple, to introduce the members from the county who are here. And I'll start with the honorable CEC members who are here. I will start with myself, Dr. Gregory Ganda. I'm the CEC member for Kisumu. We have Award Julius Nyerere, Mwalimu, CEC for Migori. Stand up, thank you. Makofi. Dr. Martin Konyango, the CCM Siaya. Dr. Andrew Amalwa, CCM Bungoma. Mr. Bedan Maina, CCM Nyamira. And Dr. Nicholas Mwaniki, CCL Vihiga. We also have chief officers who are present. I'll allow them, all of them, to stand up for us to recognize them. Please stand up. Led by Dr. Lucy, Dr. Mary Ayenda. I think the only two of them. All right, and directors who are present from the Lake Basin region, please stand up. Makofi kwao, I'll not name all of them. And then CHMT members who are present from Kisumu, I know you are here. Please stand up so that we see you. Thank you. And board members of facilities, I know JOTRH board is here. Are they here? Thank you. I think on behalf of CCs, I know I cannot give a speech because my governor will be giving a speech, and so I'll be repeating. But I want to say that as CECs and members of the Lake Region Economic Bloc, we are very proud of this moment today, and we are happy that finally Kemsa will have a full logistics center inside here. And that means that the turnaround time for our supplies in terms of health products will come down. I think we are happy that this is going to serve us well, and we will be working very closely with our former colleagues who are with us in the county, Mulwa and his team, to make sure that our patients actually get value for their time, and we deliver healthcare the way we are supposed to deliver. Madam, when you get time, please also visit our zipline drone hub, which serves the Lake Region Economic Bloc, because that is also part of the logistics management. And we hope, and I asked at a meeting with the Kemsa directors when they came to visit the governor, that they should partner with them, because that helps us with emergencies. It's not possible to stock emergency medicine like anti-snake venom in all facilities, but it's possible to have them at a hub where whenever it is required, it is drawn into them. So thank you very much, and welcome all of you to Kisumu on behalf of my governor, my deputy governor, and the team from Kisumu, and the Lake Region Economic Bloc CECs. Asante.
Thank you very much, Dr. Ganda. Tumpigieni makofi jameni. It's now my humble duty and pleasure to invite the chairperson of the Kemsa Board of Management to make his remarks and introduce his peers. Karibu chair. Tumpigieni makofi.
Thank you very much, and welcome everyone. And before I go into my speech, I just wanted to introduce my board. If the board, you can just come here and introduce yourself.
Okay, I'm Dr. Jane Masiga, Director Kemsa.
Good morning, everyone. My name is Mary Awino, Director Kemsa.
Good morning. Stephen Pitok, Director Kemsa, alternate to the Principal Secretary Medical Services.
Bernard Bett, Director.
Apologies from one of the directors, Hesbon Omolo, who's out of the country. Thank you very much, directors. I also note the county commissioner is around. Maybe he can also come in to welcome us to Kisumu County. Is there? Oh.
Good morning, everyone. My name is Arika Michael Onyando. I'm the Assistant County Commissioner standing in for the County Commissioner who is held up today in Nairobi on official duties, but he ought to have been here with us today. Having said that, my role is very simple, but allow me to mention 2 or 3 things. One, Madam CS, we want to appreciate you for this very great event and for having chosen Kisumu. I want also to assure you that in Kisumu, there is no parity between the national government and county government. We work as one body, and that is an assurance that the security of the center will be at utmost, and every work that is going on will be monitoring together, both the national government and the county government. Secondly, allow me to say that Kisumu is very central and very key in this region, hence the significance of the center. And the presence of the other counties' representatives here proves that fact, the centrality and the significance of Kisumu. So having chosen Kisumu for the center will not go into waste. I want to believe that the facility is going to be of help and is going to assist the region at large. Also allow me to mention that having the center around, as have been mentioned by the earlier speakers, is going to help us ensure that the former shortage of drugs and the long time taken to order them from the distribution centers is already dealt with, and we believe it's a thing of the past. Madam CS, also allow me to mention that this will ensure that the supply chain of health products in the region is improved, which is one of the core functions of Kemsa. And as I conclude, we welcome you to Kisumu, Madam CS, and even after the event, Kisumu is secure, is peaceful, the environment is safe. Even after the event, you can still take more time and I believe the Deputy Governor will ensure that you don't run away as if the event is what brought you. We are happy to host you. Thank you, Madam CS, and we welcome all of you to Kisumu. Thank you very much.
Thank you, County Commissioner. Dr. Susan Nakumicha, Cabinet Secretary for Health, Your Excellency, Governor Tichilo, Governor for Vihiga County, Deputy Governor Dr. Willie, DG for Kisumu County, the board members, the Kemsa CEO, Dr. Mulwa, all the chairs, my fellow colleague chairs present, CEOs, CECs, chief officers, all Kemsa staff, distinguished guests, ladies and gentlemen. Welcome to the Kemsa Kisumu Regional Distribution Center. This center is a milestone marked under the Kemsa Transformation Agenda. The idea of establishing a fully operational RDC in Kisumu was first conceived in 2016 as part of Kemsa's efforts to decentralize the distribution network in order to improve access to healthcare products in the region. However, despite the initial plans, the project faced several challenges that delayed its implementation. These challenges included logistical issues, funding constraints, and the need for extensive planning and coordination with various stakeholders. After months of consistent follow-up, overcoming obstacles and meeting challenges with tailor-made solutions, we have finally arrived to a goal where the Kisumu RDC has finally been launched. The establishment of the Kemsa Kisumu RDC marks a significant achievement in Kemsa's ongoing transformational agenda. As a government supply chain agent for health products and technologies, Kemsa plays a vital role in procuring, warehousing, and distributing health commodities to public facilities and programs. With a mandate to provide cost-effective supply chain solutions, Kemsa focuses on bulk procurement, centralized warehousing, stringent quality assurance, and timely delivery of health commodities to the last mile. This approach not only ensures the availability of essential health products, but also results in significant cost savings that benefits its clients. Your Excellencies, ladies and gentlemen, the Kisumu RDC represents a promise fulfilled by the board and management to transform Kemsa into a more effective player in the health delivery system. This facility will receive medical supplies, process customer order, and distribute them to customers in the Great Lakes region. Initially serving 11 counties in Nyanza, Western, and North Rift regions, it will gradually expand to serve 19 counties by the end of this year. The facility is spacious enough to facilitate efficient supply and cold chain solutions for regular essential medical services and serve as an emergency buffer stock holding and regional distribution center, aligning with the fourth schedule of the Constitution's decentralized efforts. Welcome, Governor. Karibu, Governor. This decentralization initiative aims to streamline processing of the National Supply Chain Center and reduce the order turnaround time by approximately 40%. Since its inception, the Kisumu RDC has processed essential medicine orders from 4 counties valued at more than 295 million. Additionally, an order of 36 million from Kisumu County has already been uploaded in the LMIS, and between 15th February and 29th February, programs worth 200 million have been picked and dispatched from this center. Your Excellencies, ladies and gentlemen, allow me to highlight some of the recent strategic transformation efforts that have been undertaken to revitalize Kemsa. Since the Board of Management was appointed in May last year, we have worked cohesively to address major shortcomings that were hindering the seamless distribution of medical supplies. These efforts have focused on improving key areas such as procurement, finance, governance, risk management, human resources, IT and support systems, and warehousing and logistics management, specifically targeting our order processing, inventory, distribution, and transport management. In recognition of Kemsa's critical role as a security institution responsible for wholesale procurement of health products and technologies, the board has adopted a comprehensive turnaround strategy. This strategy aims to restore functionality and enhance operational efficiency throughout the organization. By identifying and eliminating inefficiencies, the board seeks to instill a culture of operational agility at every level of the organization. These strategic initiatives are essential for ensuring that Kemsa can fulfill its mandate effectively and continue to serve the healthcare needs of the nation. Ladies and gentlemen, in the past half year, I'm glad to confirm that we have made strides in strengthening procurement to realize value for money, and the board remains optimistic that this will significantly impact on the cost of medical commodities by the end of this financial year. I must point out that alongside the priority reform areas, several other capacity building initiatives, mainly focusing on quantification, commodity management, and logistic management information system, have been rolled out by Kemsa to improve forecasting and guarantee an uninterrupted flow of health products and technologies to the counties. I'm happy to know that these efforts have borne fruit by boosting facility ordering capacities and also the turnaround time. Efforts to enhance organizational integrity and efficiency have also been stepped up, and we are in the process of developing and launching a new ERP system which will enhance end-to-end visibility in the supply chain and also pave way for e-procurement. Your Excellencies, ladies and gentlemen, in the last 10 months, Kemsa dispatched more than 22.5 billion worth of essential medicines and medical supplies, and national health strategic programs supplies countrywide. By a very long shot, Kemsa is regaining its sparkle as the last mile delivery of more than 86,000 EMMS and the National Health Strategic Program supplies orders dispatched to more than 8,954 facilities countrywide. Today, I am encouraged to report that the reform endeavors have seen Kemsa register significant improvement in organizational efficiency, underscored by the reduced order turnaround time for hospitals, which has come from 15.8 days in February this year, down from last year's 17 days. While the primary health facilities, the turnaround time has come down from 20 days to 16 days from April last year to this month. The order fulfillment rate has also gone up to 62% from the average of 49% as of last year March. Our goal is to sustain these gains through continued improvement, monitoring and evaluation, capacity building, and stakeholder engagement in order to further enhance the overall efficiency of the organization and provide better services to Mwananchi. Ladies and gentlemen, Your Excellencies, on behalf of the Kemsa board, management and staff, I wish to confirm that we are up to the task bestowed upon us because we are your partners in healthcare. We commit to tirelessly work to ensure that health commodities are delivered and available for patients' use as required. A medical need cannot be postponed, and developing such a regional distribution center demonstrates our commitment to fixing the infrastructural challenges that previously constrained effective service delivery. This facility will provide all under one roof solutions, including quality assurance, quality storage, cold chain, and administrative functions to power an effective Kemsa. Last but not least, I wish to request counties who are our clients to consider paying off the outstanding debts with Kemsa. Some of our clients have long-standing debts amounting to about 3.2 billion that constrains our capacity to deliver our services. We will continue to engage closely with the Council of Governors and respective county governors to unlock the settlement of these debts. Finally, I also wish to extend gratitude to our development partners under the auspices of the Development Partners for Health, in Kenya, and our parent ministry, the Ministry of Health, for their continued support to Kemsa. On behalf of the board, I reiterate our assurances to provide prudent management oversight and policy guidance as we express our gratitude for your continued support. At Kemsa, we pledge that we are your partners in healthcare. Thank you very much. Let me then take this opportunity to invite the DG Health, Dr. Amoth, who will take us to the next session, inviting the members of the National Assembly and the Senate. Thank you.
Thank you, Chair. Our chief guest for today, the Cabinet Secretary for Health, allow me to ride on the protocols earlier established because of time. But let me also add my voice to congratulate the Board of Management of Kemsa for this great milestone in establishment and official launch of this regional distribution center. This is in line with our approach to decentralizing healthcare services, in line with our approach towards universal health coverage, which is premised on a primary healthcare approach with a strong commitment to preventive and promotive health. I am glad that this center that we are officially launching today will lead to better turnaround time and order fill rates, especially for essential medicines and medical supplies, which are primarily utilized at the primary healthcare level, that is at the health center level and dispensary level, therefore leading to better services. As a ministry, we will continue to support both the counties and Kemsa, especially in terms of capacity building for forecasting and quantification, so that we can be able to get value for money for the resources that we have at our disposal. Allow me at this particular juncture to call on the Honorable Member for Endebess, who is also the Chair of the Parliamentary Health Committee, Dr. Robert Bukose, to make his remarks and also call upon his colleagues to talk to us. Mheshimiwa.
Good afternoon. Our chief guest, the CS Health, Governor Will Pautichilo of Vihiga and Governor Ken Lusaka of Bungoma, Chair Kemsa, CEOs who are here, Kemsa family, CECs, and everyone who is here. Good afternoon. I'll invite my colleagues. Please come here so that you can introduce yourselves. You can introduce yourselves and say jambo. We'll begin with the member, Honorable Martins Owino, please.
Yes, Waziri, my name is Martin Owino, but the name which is known here is Nyamrerwa #1 because of my public health credentials. When we came in, Waziri, they welcomed us with a song. That is a social medicine, and we're grateful for that. One thing I want to say, Chair, is maybe if I illustrate it this way you may understand, then I'm done. When you are sick and the doctor prescribes, take this medication once or twice or 3 times. It means that the drug blood level must be sustained in order to fight the organisms. If you miss, then they take root, and fighting it may be very difficult. That is why this efficiency and effective supply of this medication to our health facility is very important. Because one of the things that are causing poverty and disease advances in our community is delaying of intervention, especially medical intervention. So I think we will support on our side so that you get them on time. And to the counties, it is now your responsibility. Make sure when they get to health centers, they also go to the patient's mouth on time. Thank you very much.
Thank you very much, my chair, our chief guest, Waziri, my governor, and all the governors. Now, those wengine bana asifiwe. Mine is just first to really thank Waziri here, because Waziri, in 1 year and a half, you've been able to address so many things that had stalled in healthcare. Today, we are launching this center. Very few months ago, we were able to pass the laws that are now going to actualize UHC. We want to thank you and just ask Kemsa what my good friend Honorable Martin has said. Kemsa to be efficient and be effective. That can only happen if the drugs are getting to the patient. If we are able to put in place a mechanism to monitor drugs from Kemsa to the county, to the health center, to the dispensary, and to the patient. Lastly, I also want to ask our governors, all of us as elected leaders, when we are vying for election, we at one time promised to ensure that we are going to give our people affordable and accessible health care. And that's why it is also our duty as elected leaders to rally and support and champion the actualization of UHC. Otherwise, mimi ni kuomba tu, hata tuki-launch UHC, tuki-launch center, pia lazima tuweke baba kwa maombi, ile mambo yake AU iende sawa sawa. Asante sana.
Asante, Honorable Martin Pepela. I want to invite Dr. Nyekal, member for SEME.
Waziri, Honorable Minister, the governors that are here with us, Governor Lusaka, Governor Utichilo, the Director of Health and his team, the Chair of Kemsa and his team, the CEO of Kemsa and his team, and all the CEOs of the sagas that are here, the CECs that are here with us, my colleagues from the National Assembly and the Senate, the community health promoters. I'm so happy to see you. When this document was written in 2005, little did we know it will get to this level. It has. Waziri, let me also start by appreciating and thanking your efforts, together with your team, the chair of Kemsa and Kemsa, that you have actually devolved and decentralized the distribution of drugs to this level so that people can get the care that they need. It gives us the opportunity as oversight team to interact with all these people. Me, I always say, if all of you guys, all of us are here, why aren't Kenyans getting good health? Who do we want to come? We have a minister, we have the governors, we have MPs here. Why can't Kenyans get good health? So at least for us oversight people, it gives us this opportunity to see how we can work as a team. And that's really as much I'll say. But there's one thing I'll say, and I'll direct this really to the Honorable Minister and Excellencies, the governors and the Deputy Governor of Kisumu, that there ought to be a structure. We can put all these things in place. We do it once, it will succeed. But if there is no structure that works on a daily basis, it will not. And for Excellency Ken Lusaka. There's something I want to say that we discussed a little earlier. There has to be a link between the counties and the national government. I was told there is provision under the Council of Governors and I think the intergovernmental mechanism where the CECs meet and share with the national government what is required. And my view is that that structure, my colleagues, it must work. I don't see why it cannot meet at least once a month. So they sit down and they know County A, County B, County C, our problem is this. County A, County B, County C, our drug situation is like this. County A, County B, this is what we are experiencing. And this can then be linked through the Honorable Minister and the chair of the Health Committee of the Council of Governors. And through that, it then can go to the Council of Governors and to the summit if necessary. Then they can say, what is the problem? Why are we not having drugs? And we share that every month. Me, I would say every month. But at least every 3 months. Then we will get these problems. All I'll do, if that structure is done and the Council of Governors and Waziri take it up and we leave this year, most of them are young, I can see them, they'll deliver a lot. I really pray for that structure. The other one, I don't see why in this country we can't employ 290 pharmacists for each sub-county whose job is just to find out what is the drug situation in every level 2 and level 3 and level 4. And this feeds back to the structure I was saying, so that Dr. Mulwa at all the time has a bird's view of what is required because his clients are the counties. If other people benefit, that is bonus. So I think if we have those two structures and we implement them, and I'm sure Waziri is here, 2 governors who are my friends are here, the deputy governor who is my friend is here, the DG is here. Sisi sote, we have only one patient, and that patient lives at the county. There's no patient who lives at the national government. Do you know one? And finally, Waziri, with these structures in this place, we are asking for a level 6 so that our referral system is complete. And I think URTH and Maseno should come together and be the level 6. I hope I've not said too much. Thank you.
You know, Dr. Nyekal has been a PS, he's been a director of medical services. He's seen everything, and he's been our teacher. So we allow him a little bit latitude. On behalf of the area member of Parliament, Honorable Shakil Shapir, please welcome the members.
Yeah, thank you very much. I'm Jackton Achola. The height is a problem here. I'm Jackton Achola. I'm standing in for Honorable Shakil Sabir, Kisumu East MP. I don't have a lot to say because you know a representative, if you represent an honorable, the only responsibility you have is to take back the message. But the few things I can say, to the CS, what he has said, he really appreciates the work of the CS. Since you joined that office, a lot of technology you have brought to that office has brought a lot of improvement. Now he believes that the launching you are doing today is going to make effective services from the Kemsa. Last but not least is about the CHCs who are here. How many are there? He's requesting the CS to look at the welfare of the CS. They are doing a very effective job. in all the areas. So it's asking for the equipment for the CSCs because of the seasons. They are traveling in different seasons. Again, lastly, it's ready to work with you. It's ready to be with you. It's in national government. It's ready to work with you. Anything you think you can take, you can ask the Honorable Sakil Sabir. Is ready to do. Thank you very much, members of Parliament who are here, Governor who is here. Thank you very much. Let me take back a positive report to Honorable Sakil Sabir.
Thank you. Honorable Oron is reminding me that this is not Kisumu East. Kisumu East is a neighbor. So, Honorable Joshua Oron, the member for Kisumu Central, please.
Cabinet Secretary for Health on Nakumija, Wafula, Excellency Governors and County officials present here today, Kemsa Board of Directors led by Chairman Honirungu Nyakera, my Chairman and colleagues of National Assembly Committee of Health, and Kemsa Acting CEO Dr. Andrew Muller, and other dignitaries here today. I'm extremely excited to welcome you here today in Kisumu Central constituency, where I'm the Member of Parliament and where we are launching this regional distribution center today. Kisumu Central is in Kisumu County. Those visiting Kisumu for the first time, we welcome you to enjoy the great hospitality of our people and beauty of the city, and find out why some people do call this place Europe, because of its hospitality. Today, I'm wearing two hats. I'm wearing the hat of Member of Parliament for Kisumu Central, but I'm also wearing the hat of a Member of Parliament for Kisumu Central and a member of the Health Committee for National Assembly. Ladies and gentlemen, I wish to thank Kemsa for their wise decision to open a regional distribution center in Kisumu, Kisumu Central and Kisumu County. I also wish to thank our Governor, Professor Peter Nyang'nyong'o, and the political leadership of the constituency and the county for creating a conducive environment, an environment that has convinced Kemsa to have this regional distribution center here. The fact that 10 to 11 counties will be getting their drug supplies from here is a strong statement and endorsement of our county. We know that opening of this center has been pending for some time, but we are happy that it's finally here. And we thank Kemsa for that. As a member of National Assembly Health Committee, I'm happy that Kemsa is rebranding itself by engaging in very positive developments. 2 years ago, Kemsa was in bad shape, and many people thought it would not survive the many scandals that shocked the country. I trust that the new board of directors and the CEO have bought new brooms and are sweeping every corner of that parastatal to make it great again. Ladies and gentlemen, Kemsa is a strategic agency because of its role in the procurement of medicine for public hospitals. Hence, the reason the government must keep a keen eye on its performance. Kemsa must exhibit zero tolerance to corruption. The rot we witnessed in the past must never happen again. We believe the new management is equal to the task. I hope and trust that opening of this regional distribution center will improve the availability of drugs in our hospitals and the facilities in the region, if not Kisumu County. Thank you very much. Thank you.
Thank you, Honorable Ron. You know, Honorable Ron told me he has a written statement. And when I asked him now, you need to compress it, he said, you know, being a Luo is a lifestyle. So he has to have a written statement. Thank you, Honorable Ron. Thank you. Thank you, CS, for inviting the Health Committee to this meeting, where you today launched the Kemsa Distribution Center at Kisumu. What I would want to just mention are two things. One, we want a clean Kemsa, which must change right from the attitude of all its employees. Whoever is working in Kemsa must have a new attitude. You must be willing to forget the past and support the new changes that are happening. And I want to laud the chair together with the CEO for those new changes which you are doing. And we want to see real results from what you're doing. Because when you read every now and then, Kemsa, and especially in matters procurement, because that is where the biggest challenge is in Kemsa. Everybody wants to be in the procurement section. Everybody wants to be engaged in a deal on purchase of medicines or non-pharmaceutical things. And recently, I think we heard of even the procurement in charge being told to step aside. Actually, when you get into that position, you should be able to understand that you need to do the right things. Not getting into that position because you want to engage in deals. That should be something of the past. That should not happen. My second appeal is to both the national government and the county government. Let's make our hospitals better facilities. I don't see why, when you look at from NHIF point of view, when you look at the claims that are being made in NHIF, the majority are from private hospitals. Why can't public hospitals make more claims? It's because the services that we are offering are substandard. And I want to commend some of the facilities which the committee has visited. Moi Teaching and Referral Hospital, I think, is one of the best hospitals in this country today as we speak. Our committee went to, when you go to Moi Teaching and you go through the ward, you go through the hospital, the cleanliness, the way the hospital is being run, it's an exemplary kind of service. Kenyatta University Teaching and Referral, Daganes Hospital, is another hospital that you can go there and you get the services that you will get in Nairobi Hospital, that you get in Aga Khan Hospital. And they should be able to compete effectively with those facilities. This week on Monday, my committee went to Mathare, and we were impressed with what we saw in Mathare. You find mad people, but wherever they are sleeping in nice places. So we must be able to look at our facilities, both at the county and sub-county and even at level 2, level 3, and make sure that our facilities offer the best. So that when you are side by side with a private institution, any Kenyan should be willing to move into any facility without any second thought that I'll go to this facility and not get what I want. But this is also to Kemsa, that let us supply what the counties want. Let us supply it should be demand driven. So that we were looking at, that's why some of us had some interest in what you are supplying and why whatever you are saying was not be able to be supplied. And my committee will come. This was the minister's visit. We'll do our own visit, which is different. You know, the minister will babysit you. Myself and my committee will not babysit you. We'll hammer you if you don't do the right things, and we'll crucify you if you're on the wrong side. With those few remarks, I want to say again, thank you so much. We want to see the best from Kemsa. We want to see the best that we are allocating money to. We've given you 2 million as capitation, 2 billion as capitation. We want to see good results out of it. Thank you and God bless.
Another round of applause for Honorable Chair and the team of the Health Committee. This time, allow me to invite the next level of our political representation, Senator Chimera, to be able to speak on behalf of the Standing Committee on Health at the Senate.
The Honorable Cabinet Secretary, Charge of Health, Honorable Susan Nakumicha, governors present, led by the able Governor Lusaka, Governor Otichilo, DG Owili, leaders present, ladies and gentlemen, good morning. I'm Jambo. You know, when you come to Kisumu, they say you must watch over your English. Your English must be very polished. Allow me in a very special and profound manner to speak in Swahili. I've noticed everyone who came before us here was speaking in English. Mtaniruhusu kwa heshima na taadhima nizungumze Kiswahili. Mimi kwa majina naitwa Senator Raphael Chimera, natokea kaunti ya Kwale. Mimi ni mwanachama wa kamati ya afya katika bunge la Senate. Nimefurahi sana kufika hapa siku ya leo na mengi yamezungumzwa nafikiri. Sitaki kuwa mwingi wa maneno ila tu niipongeze sana bodi hii ya Kemsa kwa kazi nzuri na kazi safi ambayo wamefanya kuendesha huduma za matibabu katika hospitali zetu ndani ya kaunti zetu za Kenya hii. Unajua hapo zamani, Madamu Waziri, ukisikia neno Kemsa ulikuwa unasikia kashfa. Ukisikia neno Kemsa unasikia wizi. Ukisikia neno Kemsa unasikia uovu. Ukisikia neno Kemsa unasikia uvundo. Lakini niwapongeze sana Kemsa wakiongozwa na CEO wetu hapa Daktari Mulwa kwa kusafisha Kemsa na kwa kazi nzuri ambayo wanafanya. Vile vile nimeambiwa hapa na nimesikia hapa kwamba changamoto kubwa ni kwamba hamlipwi. Magavana wetu wako hapa. Jamani, governors, dawa ya deni ni kulipa. Nafikiri ndani ya ugatuzi, tangu ugatuzi uanze, serikali yetu ya Mheshimiwa Rais William Ruto imeweza kujizatiti sana kuhakikisha kwamba magavana wetu wanapata fedha ile ya county kwa njia ya haraka na wepesi inavyowezekana. Sielewi kwa nini hamlipi ili deni jamani. Tunataka kuona madawa yakisambazwa kwa njia ya haraka na kwa njia safi. Kwa mimi nawaomba mkikaa pale COG, tafadhali zungumzeni na wenzenu muweze kuhapa hawa Kemsa pesa kwa haraka ndio kazi iendelee. Vile vile niseme tu nikimalizia, unajua nimemuona Daktari Mulwa hapa akiwatambulisha wenzake madaktari wengi, CEOs, lakini wote wanahudumu katika nafasi zao kwa njia ambayo ni huduma kamili. They are not in acting capacity. Madam Waziri, huyu bwana anafanya kazi mzuri bwana. Si ukweli usemwe? Tuseme ukweli, na mimi naomba tu ile acting iondolewe. Ndio huyu bwana aendeleze safari hii ya Kemsa, tuone kazi safi wanayofanya, wananchi wetu waweze kupata matibabu na huduma kwa njia haraka. Unajua akikaa venye anakaa sasa, ana wasiwasi. Kuna mambo mengine hawezi fanya. Kuna maamuzi hawezi fanya. Mimi nakuomba tu waziri, sijaonwa lakini anafanya kazi mzuri. Napongezi sana Daktari Mulwa kwa kazi njema hii. Nikimalizia mwisho, Mheshimiwa Oron, mimi ni kijana na ni mara yangu kwanza kufika Kisumu leo. I am ready to sample Kisumu City. As a young man of this great nation, I am more than willing to sample this city. Nikaribishe. Asanteni sana. Mwenyezi Mungu awabariki. Na nikimaliza ya mwisho niwakumbushe tu kwamba Sisi kama kamati ya Senate ya afya tuko tayari kufanya kazi na hawa watu wa Kemsa na wizara yako Mheshimiwa Waziri, lakini kazi yetu ni moja tu, ya kuhakiki utendakazi wa wizara yako, kuhakiki utendakazi wa hawa Kemsa. Tuko tayari kufanya hiyo kazi bila kuogopa. Asanteni sana, Mungu abariki. Shukran sana.
Let's give another round of applause to Senator Chimera. I hope the people of Kisumu, you understood in a nutshell what the senator said. We'll be able to offer translation services later in the evening. This juncture, allow me to invite Your Excellency, the Deputy Governor of Kisumu County, Governor Matthew Owili, to come and take over the rest of the program.
We had to do this so that in the evening, it is not in doubt that the CS was in Kisumu. And I would like for us to give a round of applause to my brother, Dr. Amoth. So our chief guest for this very important occasion, the CS of Health, the Honorable Nakumincha Wafula, the Governor of the great county of Bungoma, who is here today, Karibu Sana, the Governor of the great county of Vihiga, our very good neighbor, Karibu Sana. Allow me also to recognize the Senator who has just spoken here. I want to give you the assurance that Dr. Oron will take very good care of you today for the next 1 week. You don't have to get back. Now, members of the National Assembly Health Committee, and I recognize my very good friend, Dr. Bukos, and all of you who are here today. I also want to recognize the chairman and the board of directors of Kenya Medical Supplies Authority, the Honorable Rungu Nyakera, a very good friend of Kisumu. You, together with your team, you are welcome. Allow me also to recognize the CEO of Kemsa, who was once a member of the devolution family, Waziri. My very good friend, Dr. Andrew Mulwa. All CEC members, and they have been recognized by Dr. Ganda, all invited guests, ladies and gentlemen. Bwana Yesu asifiwe. Kwanza kabisa niwalete salamu. Najua ilisemekana hapa kwamba watu wa Kisumu hawezi ongea kwa Kiingereza, kwa Kiswahili. At the last time they tried, they dropped and died. Kwa hivyo kwanza kabisa nichukue fursa hii niwalete salamu ya mstahiki gavana wa gatuzi hili la Kisumu, Professor Peter Anyang' Nyong'o. Si nimejaribu? So, Madam CS, the governor is called. And I want to also welcome the governors who are here and everybody else who is coming from out of the county on behalf of the governor, Professor Peter Anyang' Nyong'o. Please feel welcome. And again, as I said earlier, the city MP will be taking care of the guests on our behalf. That said, I also want to thank you on behalf of the governor and the people of Kisumu for the choice of Kisumu to be the hub. I know that of the 11 counties that you're talking about, you could have easily taken this hub elsewhere. So we appreciate your ministry and yourself for choosing Kisumu and not Bungoma, I can see, or Vihiga, we do not take it for granted. And Madam CS, I know that I don't vote in Parliament, but one of the choices of the Kenya Kwanza administration that won my admiration was your elevation to be the CS in charge of health. And I know that you're working with a very good team and a wonderful team. And you've been having a broom, a big one that is sweeping really clean. And I know that you're working with my brother also, the DG that is in charge of health, not deputy governor this time, but the director general, who also happens to be a son of this soil. But allow me to say, other than the fact that you fit the bill, there are many things that work for you in terms of the functions that you'll have to deliver in your current docket. Now, of all the functions in the Ministry of Health as we know it, this particular one, I think, has to succeed. And even given the fact that your past was within the pharma sector and the pharma industry. Back home here, we believe that for you to cook, you need 3 stones. And I know that you are leading a very wonderful team at the ministry. One other wonderful team that you have that must not come only to play their oversight role is the committee at the National Assembly. Within that committee are thoroughbred professionals. And some of them, by the way, have trodden the same path that you're treading today. If you consider Dr. Nyekal as one example, he was once the Director of Medical Services, right there. But Dr. Bukose, from the time I met him in early 2000, all the way in Kapenguria, before I knew that one day he will be sitting in the position where he is, I knew from day one. And by the way, I've been following you. What I'm trying to say in a nutshell, Madam Waziri, that in your pursuit or in your dream to reform the Kenya Medical Supplies Authority, this team that is sitting here today, and I would have said a thing about each one of them, they are a resource that you can tap into in ensuring that things work for you within this particular sector. And I know the cartels will be coming very soon, okay? And from Kisumu, we want to tell them, those cartels who have made Kemsa ungovernable in the past, that they should let Waziri, together with her team, to do her work, because the people of Kenya need affordable, available medical commodities like yesterday. Now, the other thing that works for you, and I think sometimes it's good to know your strength, is the fact that you have a very able team at the Committee of Health at the Council of Governors. Now, that's the other team that you must put very, very close to you, so that, because, you know, health is a devolved function. Of course, we have different components that we handle, both national government and county governments. And I believe that the Council of Governors, through that health committee, would be willing, more than ever before, to support you, because when you don't have commodities, we are the ones the people ask. But also the fact that you have a very wonderful team, both at the board and at the managerial level. Yeah, Dr. Mulwa, with all due respect, was one of the. So he understands the need of counties. So we expect you, Daktari, that working together with your colleagues and supporting Waziri's dream, that the reformation or the reforms that we are expecting from Kemsa, is expedited. It should take you a shorter period and a shorter duration because of the thorough understanding that now you have of the devolved units that are charged with the responsibility of ensuring that things work. Now, let us also borrow on innovations. Just sitting next to you is Governor Otichilo, who is an authority on matters GIS. And I think in everything, in every function in his county, he can check. I know we were asking ourselves how we can be able to tell, where our everything. And I know you're already doing quite a bit, but we can compare notes. Back here, Dr. Ganda talked about the zipline drone technology for supplies that must get to the facility urgently because of the need. You're talking about vaccines and stuff like that. if Kemsa can be onboarded in terms of those commodities that may require, urgent supplies, so you don't take your 1 hour between here maybe and another place where you may need to go. And I know that here in the county of Kisumu, we have done quite a bit that we can also share. Long before your dream of onboarding the community health promoters, we had them on board and we used to call them community health workers. Because Ariambo kosawa chadiel. Na wako hapo. So we can compare notes. Long before we thought about onboarding the indigents, Kisumu was already in place, the Marwa, health insurance for the indigent, those who cannot be able to afford, medical service or because of the lack of money. But also we know what does not work, especially for camps, and we've talked about it. We've talked about stock outs, we've talked about fill rates, we've talked about non-flexibility in payments. I know sometimes you want us to pay as fast as we can, but also we rely on that money to come from elsewhere, and I know that the governors who are here will be talking about that when it is their time to speak. Okay? But we appreciate the fact that you are very affordable, and your last mile delivery to health facilities, I think, is something that we want to appreciate, and also the introduction of the last mile proof of delivery, or what you are implementing called the e-pod. So those are some of the progress that we think if we work together, the three arms that I've talked about, we can be able to get to the best level that we can. Now back here in Kisumu, other than requesting that you onboard Kemsa with Zipline in terms of the commodities that may need to get to Homa Bay as fast as possible, and I've seen the minister right there, we also want to request, Madam CS, that you give utmost attention to the request of Kisumu County for the elevation of Jaramogi Oginga Odinga Teaching and Referral Hospital from a level 5 facility to a level 6 facility. It is something that we have been following up for a very, very long time, and I want to thank Dr. Nyikal. It's one of his pet topics that he likes to speak about, and we are looking forward that in your tenure, maybe in the next 6 months or maybe 2 months, maybe 1 month, that this can be actualized. And I know that you are aware that we have 2 medical schools within Kisumu. We have Maseno using Jaramogi Oginga Odinga Teaching as a teaching facility, and then we have Ozima. Now, we need the elevation so that we can operate at the same level as JOTRH and at the same level with MTRH. Okay? And maybe we could ask this of many other facilities, but I think JOTRH should be number 1. Then we can onboard the others, because there are very many that may need the same service. Otherwise, on behalf of the governor of the great county of Kisumu, we thank you once again. And I know that in our shared responsibility of providing healthcare to the people, we promise to work together with you now and in the future. Allow me now to invite up front the governor of Vihiga, who is also our neighbor, who will come make his remarks, and then invite the deputy or the vice chair of the Lake Region Economic Bloc, Governor Lusaka. Then we proceed like that. Karibu sana governor. Asante. Tumpigie makofi akikuja.
Our CS for Health, members of Parliament who are responsible for the Committee on Health, also members from the Senate, the members of Kemsa, our CEOs from various health organizations, our members from our counties, the CECs, the chief officers, and all who are in attendance. First and foremost, I want to take this opportunity to thank the ministry for what they have done to devolve Kemsa activities to the Lake Region Economic Bloc. We are very happy, CS, for this gesture. We have a lot of respect and expectation from Kemsa. I'm a second-term governor. I've had a chance to work with Kemsa for the last 6 years, and I know where we have had challenges and where we have had a good time. But I want to take this opportunity on behalf of my colleagues from the Lake Region Economic Bloc to wish you well in your coming to the region and best here in Kisumu. We believe you are going to give us excellent service now that you are right in the midst where we are. We believe your services are going to improve tenfold. We also want to register our concern that as when we are going around, you are demonstrating to us on how we receive orders and so on. CS, one of the biggest challenge we have had, and I think we noticed here today, is when counties put orders. Normally what we put as our orders, essentials, we don't get all of them. And that has been a major a challenge to us. And particularly as the Committee on Health, and particularly Dr. Nyekal and the rest, Dr. Pokose, noticed, most of the essential drugs and pharmaceuticals, normally when we put that order, we don't get them. So we find ourselves in a very awkward situation where you are given drugs that are not in high demand. So I would like to take this opportunity on behalf of the governors in this region to really plead with Kemsa that come up with a very long-term process, a plan, where you will ensure you look at which are the drugs that are in high demand, drugs that are required on a daily basis, the ones that have high demand. If you can have those in stock for 6 months, then we will be able to have these drugs availed to our counties without any problem. Because CS, if you go to some of our health facilities, you will find all sorts of other drugs, but they are not in high demand. So sometimes we end up them expiring and we have a problem to dispose of them. So I think it's important that Kemsa, you take up this matter. I also want to assure Kemsa that we as governors, we are committed to pay in time. And we will try as much as possible to pay. But as you have heard, we also get this money from elsewhere. But I want to laud the CS, the type of transformation and reorganization that she's bringing into the health sector in terms of insurance, in terms of the social health authority entity that is coming in place, and how we are going to manage health care system. I strongly believe the issue of non-payment is going to be an issue of the past. And particularly when it comes to the issue on facility improvement fund. Once that facility improvement fund is actualized at the national level and also at the county level, then the health facilities will be able to collect money at source and spend that money at source. And therefore the issue of lack of drugs and lack of other non-pharmaceuticals will not be there. So I would like to congratulate the CS and wish that you fast track that process so that from requirement, the percentage of our budget that should go to health facilities, to health, is less. So I would want to request you that you work so hard to ensure that we get more money so that we can be able to improve our healthy service delivery. Finally, I want to also say that if I compare the previous dispensation, where I was the governor in the last dispensation, and now, I can see a big difference. And particularly when it comes to engagement with the Ministry of Health. I can tell you in the last dispensation, Council of Governors, we never had a chance to sit with the CS of Health. We never. We only had just, the directors coming, but we never had. But the short time we have been with the CS, we have engaged severally, and we have done a lot of consultation. So we want to laud the CS for being available to us and realizing that health is a devolved function and we must work together. What we want as a Council of Governors is that once we agree on an issue, let it be implemented as agreed and not the other way around. Thank you and God bless you. Sorry. Now it's my pleasure to invite our Vice Chair of the Lake Region Economic Bloc, His Excellency Lusaka, to address you.
Thank you so much. I forgot to bring my podium. Well, I've seen governors have a lot of drama with the podium, so I think my communication team must be worried. Our guest of honor this morning and afternoon, my sister Nahumicha, who is our CS Health, colleague Governor Otichilo, the Deputy Governor, members of Parliament, the team from Kemsa. I came in late, so I don't know who exactly is here. Allow me to ride on the established protocols just in case I give you wrong titles or I don't recognize you. I also want to associate myself with the sentiments that have been expressed by my colleague as the Vice Chair of this region, that clearly the Minister for Health has given proper direction in this ministry. I'm a neighbor here and we also eat fish. And we say fish rots from the head. So if the head is rotten, then there's no fish. So if an institution is not performing, it's just the head. But we see a lot of improvement and a lot of work now in the Ministry of Health. It's now vibrant. Everybody knows who Nahumicha is. It reminds me of those days of Michuki. When Michuki was in internal security, everybody knew. When he went to environment just came up. So it is the head who really determines. I also want to laud what is happening at Kemsa, because in management we say shock therapy. That's what you have done. You need some shock therapy to bring order in that institution. In fact, at some point it was very dangerous to say you work for Kemsa. Because I think Kemsa, people were looking for Kemsa fellows because it's like they were moving with scandals in their pockets or the scandals were all over. And that's where everybody was going. But I think Kemsa is now coming back with the management that is there. We see a lot of hope. What we should avoid, just like my colleague has said, because sometimes we seek for drugs, but what we get is not what we have requested for. And you know, health is devolved. Yesterday I had it very rough with my committee on health because they were saying, why are you not putting more money on health for drugs and such things? Because health touches Mwananchi, and that's why it was devolved. Goes up to the dispensary level. So if there are no drugs, it's very clear. And those are areas that give governors a lot of headache and even the members of parliament. So if we have a very effective delivery of our drugs to the lowest point, then we'll have very little headache from members of the public. And they are right, because health is everything. Because if you have an unhealthy nation, you can forget about the roads if everybody is dead. If everybody is dead, you can forget about agriculture, who will eat the food. So we must fix the health first. And that is why we are determined to work together. Just like my colleague has said, my sister, sometimes when we agree, you know, there will always be a problem between the national government and the devolved functions, not only in Kenya, but all over. I am also a guru in decentralization, so I know. So sometimes ceding power from the central government is not easy. They want to hang on certain functions. But sometimes when we agree let us agree to follow what we are doing. As a county of Bungoma, we 90% of our orders are from Kemsa. So we just want to, I know we owe you something, we shall pay in due course. So when funds are available. When funds are available, that used to be a very common answer in Parliament. The Assistant Minister will stand and say, we shall do the following when funds are available, and you don't say when they will be availed. So we are our partners, and we will do our level best to ensure that we reduce, if not complete, what we owe you, and also please supply the drugs to us. So I also just came to join you, not because I'm lost or I did not have anything else to do, but I think this is important. And my people in Bungoma now know I'm here and drugs will be going to Bungoma. So this is the statement I wanted to make. I'm also a second timer like my friend Otichilo. So this is our legacy regime. It's our legacy regime, and we must really deliver to our people. Some of us have built our names for a very long time. I don't want to come and spoil my name in my delight here. So I want drugs to get to the people so that our people are happy. And our committee, let me also thank the Committee on Health from both the Senate and the National Assembly. You are doing proper oversight. And like he said, they can be very rough. But you know, our health promoters, you are doing a good job. For those who will still be seeking for elections, that is the brigade that will give you votes. They are the ones who voted for me in Bungoma, because as they inject somebody, they say injection in Lusaka. As they give drugs, wanasema hata hii dawa Lusaka ndiye ameleta. Wanamuuliza who is passing, you know, politics about perception. Wanasema wewe hujui Lusaka ndiye anapita hii kura, na wanakupatia kadawa, unaenda nayo nyumbani. So that is a very good team. There is a very good army on the ground. We need to boost their morale. As county governments, we shall pay them what we promised to pay them, as the national government also pays them. So, mufurahie sana, you have a government that cares. You have a government that cares. I know we've had a bit of challenges, but things are being fixed. I was being challenged the other day. Somebody was saying that uchumi imekuwa mbaya. Now, at uchumi, go to the airport and see how people are traveling. Go to town here and see how many buildings are going on. Sasa wanasema uchumi ni mbaya kwako. What are you doing yourself? And somebody said during Kibaki's time, the uchumi was okay. What did you do for yourself during that time that you are not doing today? So I think all of us need to roll our sleeves and do our best in whatever capacity that we are, because this is our own government. And if things are bad, we must fix it ourselves. Those who are in a hole, don't quarrel. You will look for ways of coming out. Mkiwa kwa shimo mnagombana, you will continue going deeper. So you look for ways of coming out, and I'm sure that we are now beginning to see light at the end of the day, and we'll do all that we can to support our government so that we deliver on the promises. I don't know whether I'm the one to invite the minister. Oh, this is now my distinct and singular honor to invite. You know, we were here in Homa Bay and the prayer was very complicated. And I said, when you come to Kisumu, like somebody said, you must be very careful the English you talk, because that was high tech. Now, wacha to simame. We also use that opportunity. I've been sitting for a long time to stretch.
Thank you. Ndio. Thank you very much. Let's take our seats. Our governors present, Governor Otichilo, the governor of the beautiful county of Vihiga, Governor Lusaka, the governor of the great county of Bungoma, and the two of them are my brothers. Our deputy governor for Kisumu County, who forgot to say that we have been friends for many years in this space. Our members of parliament, led by the chair of the Health Committee, and members of Parliament present. I can see Mheshimiwa Oron smiling. I will not say what you want me to say. I will not say you are incoming for anything. Member of the Health Committee from the Senate, our DG Amoth, our members of the county executive committees, especially the health CECs, our chair of Kemsa, Irungu Nyakera, together with the board members, board directors, the CEO of Kemsa, Dr. Mulwa, together with the other CEOs from the ministry who have joined us, the management and staff of Kemsa, our distinguished partners, ladies and gentlemen. Good afternoon. Oh, I forgot my army. And our CHPs, good afternoon. Afya yetu, jukumu letu. Asante sana. I am really honored to be here this afternoon to officiate what I want to regard as one of my success stories. Psalms 90, verse 17 says, "The Lord shall prosper the work of our hands." In this case, I have many hands, and I want to thank the board of Kemsa, together with staff and management, for enabling the work of my hands to be visible today. Asanteni sana. Being a supply chain management professional, although at times people doubt, but I have over 20 years of experience. And the people who have been me in this journey, some of them are here, including Owili. And my mentor, Dr. Jen Masiga. I embarked on measures that would revamp Kemsa, and that's why today, in this beautiful lakeside city of Kisumu, I am filled with a lot of pride as we commission the Kemsa Kisumu Distribution Center. This occasion marks a great milestone, not just for Kemsa, not just for the region, and not just for the health sector, but for the entire nation. Because by doing this, we are guaranteeing Kenyans enhanced access to quality and timely health products and technologies. This is in line with our journey towards achieving universal health coverage, which is a core pillar under our national development. And the establishment of this center is a clear manifestation of our unwavering commitment to bring dawa mashinani, that is medicine to the grassroots, closer to the people. And indeed, that is in line with the Kenya Kwanza's bottom-up economic transformation agenda. That in whatever we do, we have to ensure that we begin from the bottom, from the grassroots, where people are. This is a strategic enhancement of our healthcare system, set to elevate the standard and reach of medical supply distribution, as evidenced by our impressive network, distributing over 9,000 health facilities, as highlighted by our chair, is a testament to our dedication, outreach, and hard work. As we celebrate these achievements, we recognize the opportunities for growth and continuous improvement. And that was clearly illustrated when we went through the warehouse. that despite us demonstrating a very robust logistics management solution, still we had items that were out of stock. And one of the items that was out of stock is the commonly used item, cotrimoxazole, Septrin, commonly used at the lowest level of health facilities. So I want to, Chair, I don't know whether to direct. I want to direct the Chair that please, as big as this warehouse is, let us remain on our core mandate, the essential drugs. That is our core business. And if we focus and remain on the straight and narrow, we shouldn't be having items like Septrin out of stock. We shouldn't be having methylated spirit out of stock. We shouldn't be having bandages out of stock. But I want to believe that this is now an opportunity for growth and continuous improvement. The operationalization of this RDC is a critical step in our decentralized approach designed to deliver significant advantages to our clients, who are the counties that we serve. This facility is envisioned to be a bastion of efficiency and responsiveness, enabling us to surpass the laudable goal of maintaining HPT stock availability of above 95%. Chair, you clearly enumerated how you have managed to reduce the turnaround time. But now it is expected that with this regional facility, the turnaround time for facilities within the Lake Basin region should even be shorter. We should be able to cut it by a half. There's no reason why now, for example, Kisumu here should be waiting for 2 days to get drugs. We are right with them. There's no reason why all the counties around here, Vihiga is just across the river, then Bungoma there, including my county, Trans Nzoia. There's no reason why now they should be waiting for 15 days to receive supplies from Kemsa. For us to derive value from this facility, we must ensure that we cut that turnaround time to the shortest possible before we start directing that within 24 hours. And I know it is possible, actually. I know. So in our quest for excellence, I know Kemsa is implementing several measures. One, you have demonstrated the technology that we are using. But since I'm here in Kisumu, I would like to confirm, especially to the members of Parliament and the great people of Kisumu, that we are in the process of acquiring a more robust ERP system. Because what we just witnessed is logistics management system. We need a procurement system. We need a warehousing system. So now we are in the process of acquiring a robust ERP system that then integrates all this, so that then we are able to respond to your questions of managing supplies from end to end. That Kemsa can see what is happening at the suppliers level, and equally the clients that we are serving, the counties, can see what is happening in our warehouse. But I want to ask of governors who are here and those from this region and the country at large, that as we, as Kemsa, speak about 70% fill rate, that must be translated to Mwananchi. We as Kemsa, we have committed that we shall bring it to the doorstep. But please ensure that those drugs and commodities are available in the dispensaries so that the common Mwananchi kwa grassroots can be able to get supplies. Because it doesn't make sense for us to speak about 70% fill rate, yet when you go to dispensaries mashinani, you are told there's no dawa. At best, the doctor prescribes, gives you prescriptions, and directs you to a chemist around the corner. So we must work together as national government and the county governments to ensure that this fill rate, this improved fill rate, is felt at the facility level. Our enhanced procurement strategies are focused on bolstering local manufacturing through public-private partnership, ensuring that the essential products are continuously available at competitive prices. Quality assurance remains at the forefront of our priorities as we collaborate with stakeholders to maintain the highest standards in healthcare products. We are pioneering cost-effective last-mile delivery solutions, ensuring that the healthcare affordability is not just a vision, but a reality. And I want to say I'm more convicted than before that this Kemsa is on the right trajectory. And for those who think it's the old one, you are wrong. We are now on version 3. Na hii gari naipeleka mbio sana to ensure that we deliver drugs to our people. Mimi si dereva mlevi, mimi ni dereva ule anajua kazi yake. So I'll work together with my teams to ensure that we ensure that the supplies reach people. Our concerted efforts in collaboration and planning with county governments and the Ministry of Health are aimed at aligning procurement strategies to meet the specific needs of each county, thus avoiding stockouts and ensuring timely delivery of medical supplies. We have embarked on a raft of reforms to enhance professionalism, increase efficiency and responsiveness, and slay the dragon of corruption. I want to commit to Kenyans that this board was carefully selected, and we are confident in its delivery. Equally, I'm confident that the management that we have now is up to the task. Senator, sijui kama ulitumwa na Mulwa ati sasa act ya kutosha. Uliza DG mambo mambo kwa ground ni tofauti, but he's doing a good job. That's not to say that he's not, and in due course, with the due process, the acting may come out. Ladies and gentlemen, the journey towards a comprehensive, forward-thinking strategy that establishes a robust, efficient, and transparent supply chain system in support of Kenyans' health needs is ongoing. And I want to acknowledge the speakers who have spoken before me regarding the great support that I get from the Committee of Health, from both the National Assembly and the Senate. Because without that support, we would not be this far. But Dr. Pukose, to thank you very much, that you are doing a good job. And yes, please come back, because it's based on the feedback that you will give us that then we are able to straighten where we may be having some crookedness. So the Kisumu RDC is a beacon of this journey of transformation, and I'm sure it's going to illuminate our path towards better healthcare outcomes for all Kenyans. I am filled with hope and confidence in the brighter, healthier future of our nation. And I pray that this center serve as a model of excellency and a source of inspiration for similar initiatives across the country and beyond. Having said that, and now that I'm in this beautiful city of Kisumu, I would like to say a few words outside the launch of today's Kemsa. I want to thank the leadership, Governor, Deputy Governor, CEC of Kisumu. You are doing a great job on matters healthcare. And maybe I need to disclose that one of the people who I spend a lot of time with, just when I was nominated to this seat, was Dr. Ganda. So today, let me publicly appreciate you that you did a lot of inputs, and you have continued to put inputs in the changes that we are making at the national level. I talked to him very closely. I talk to Dr. Ganda often, and I tell him the advice that you gave when you were preparing me for this appointment should make sense now and make sense in the future. And Dr. Nyikal here has just said that this community health program was documented in 2005, but there was no action until Kenya Kwanza government came to office. So I take pride in the changes that we are doing. What they couldn't do then, we are able to do it now. And this government promised that it is going to revamp the community health promoters program. We promised that we shall give them kits. Nyamurerwa wa Kisumu, muko na kits ama hamuna? Muko nazo? So that is a promise kept. Nyamurerwa wa Kisumu, muko na smartphone ama hamuna? Muko nazo? That is a promise kept. Sasa imebaki stipend, si ndio? Nimeongea na DG. Amesema stipend ya county mnapata. Sasa ni ya national tu ndio imebaki, and I want to confirm to you that kabla nitoke Kisumu, stipend yenyu itaanza kupeanwa. That is the promise His Excellency the President William Ruto made on the Community Health Promoters Program. And I'm proud that we have kept the promise. So for level 1 of services, Kenyans can now access services free of charge. Because when a community health promoter comes to your house, they do not bill you for anything. They use the kits that we have given them. They do the tests. If need be, they refer you to a health facility without a charge on you as a Kenyan. What we have now started to do is to work on the second level of health. That is level 2, level 3, so that we complete the primary health care. And that's why I want to appreciate the members of Parliament for the support that ensured we now have laws, the new acts that we brought in place. And one of the fundamental changes in those acts is the Primary Healthcare Fund. The Primary Healthcare Fund is to ensure that facilities level 2 and level 3 are equipped, they have commodities, they have human resources, and when a Kenyan comes for service, they find it equally free of charge. I thought mtapigia serikali makofi. Unajua governors watasema hata sasa ni free of charge, but ni free na service yenyewe hakuna. Unaambiwa utalipishwa, but ukifika utaambiwa dawa hakuna ama equipment ya kupima hakuna. So we are making it free, but the services are available. The second thing that we have brought with the new laws is the Social Health Insurance Fund. And that is a contributory fund that as a Kenyan, you have contribute to your healthcare. I think one of the members of Parliament spoke about funding for health. And he said, I think it was DG, that we have still not met the thresholds of what is required of us. Abuja Declaration talked of 15%. As a country, we are low. We are at 11%. But even that 11%, and governors will tell you, 80% of it goes to recurrent costs. So then you are left with 20% for commodities, for equipment, and for infrastructure. That is inadequate. It cannot be enough. And that is why now we have the new laws that as Kenyans then, we fund our healthcare through contribution. In the new law, it's 2.75%. And for that now, it is no longer in doubt. The laws are in place. On 1st of March, we finalized on the regulations. They are with the Attorney General, and I'm confident that by Friday, they will be gazetted. And once they are gazetted, then we begin the 2.75% deduction. But the beauty is For the poor Kenyans who cannot afford, you are an indigent. Wewe ni mtu ambaye hauna uwezo, hauna mapato aina yoyote. Serikali ya Kenya inaenda kulipa bima yako ya afya. Kuna watu katikati mwetu kwa jamii zetu ambao labda wanaishi hata na ulemavu, ama ni mzee ambaye hafanyi kazi, hana mapato yoyote. Serikali ya Kenya chini ya Rais William Samoei Ruto inaenda kukulipia bima yako ya afya. Cha pili, wale wa mapato ya chini, low income earners, the lowest. Sasa tumepunguza kutoka shilingi 500 hadi 300. And that is just to ensure that people are able to pay for their health care. And the rest of us, 2.75% of our income. And I want to beseech our leaders, I think maybe you are the highest income earners, my brother Governor Lusaka here, Governor Otichilo, DG, watu wamekaa hizi laini ya mbele na ya pili labda. Na Governor wa future Oron, 2.75% is not too much to ask for. Because even at the moment, it is not. Even at the moment, Mheshimiwa Oron, if I was to come to your phone, you are either in a WhatsApp group making a contribution, and if you are not in a WhatsApp group, you have messages of people who have asked you to make a contribution to their health. And given your status as a member of parliament, I'm sure you do not give 10,000. You give quite a sizable amount. 20 governors here, I know they give 50 on the minimum. So now we're asking you, instead of that 50 that you give many times in a month, tupatie to 2.75% of your income, na mimi kama waziri, nitapanga mambo ya afya. But I want to commit to Kenyans that we are going to put that money to good use. The pilferage, the thuggery that has been there in the Ministry of Health, that is going to be a thing of the past. I will ensure that we optimize on the resources that we receive and we put it to good use. It is no longer a story, but after Friday, after the regulations are gazetted, we begin the journey of registration and we begin deductions of the 2.75% to take care of Kenyans. The third issue in our new laws is the establishment of the Emergency, Chronic and Critical Illness Fund. Watu wengi wanaweza kosa kujua umuhimu wa hiyo pesa ambayo tumeweka hapo. And the government is willing to put in. Jana tulikuwa na rais nikimpatia update ya hii mpango. Na amesema wabunge mtusaidie tutafute hiyo fund from Exchequer, Dr. Pukose, we need 49 billion. And he said ataongea na nyinyi mpange budget vizuri tupate hiyo 49 billion. Na ni ya kushughulikia wale wa Kenya ambao wanapatikana ya kwamba wako na ugonjwa ambao ni wa muda mrefu, chronic. Kwa mfano, mtu yule ako na ugonjwa wa sukari. Mtu yule ako na hypertension. Mtu yule ako na shida ya kidneys, anafanyiwa dialysis. Hiyo ni ya muda mrefu. So hii fund ni kuhakikisha ya kwamba tunahudumia Wakenya wote. So ukipatikana na hiyo ugonjwa, haustahili kutoa pesa yako kwa mfuko, ama uuze ng'ombe, ama ukate shamba, ama utafute lori mzima ya samaki hapa Kisumu uuze ndio ulipe matibabu. Hiyo fund itakushughulikia wewe. And that is revolutionary. Kwa sababu the Constitution of Kenya gives the mandate to the president to ensure the highest standards of health to Kenyans, and it has never been done. It is for the first time. I thought mtapigia rais makofi. Ashukuru sana. Najua DG unashangaa kama itawezekana. Itawezekana. Hiyo 49 billion itapatikana. Tumepanga budget yetu and we know that it is possible. All we need is proper leadership and governance, which is being given by His Excellency the President and myself at the ministry, and to have Kenyans pay for their social health insurance. In developed countries, it is never a question of whether to pay for your social health or not. In fact, countries that have achieved universal health coverage, it is mandatory. Everyone pays. And they pay more than 2.75%. So sisi tunaomba tu hiyo kidogo ili tukaweze kulainisha mambo ya afya. Mwisho, I know the leaders from this region. You have been to my office, including Mheshimiwa Nyikal. Every time we meet, he has to tell me about level 6 for Jaramogi Oginga Odinga Teaching and Referral Hospital. I want to commit that that journey begins today. From here, from this session, I'm here with my team. We'll go and visit. I have asked Kenya Medical Practitioner and Dentist Council to join us in the inspection so that I'm not just told a report, I can see it with my eyes, that this facility is ready for an elevation. And to thank you, together with the governor and the leadership, because we have counties who are holding on to facilities. They do not want them to go to level 6 because they believe that the national government will take it and take all the revenues. I want to say that that is not a good thinking. Because the people here need services closest to them. And the facility being here, of course, then there'll be a discussion on how revenues are shared. So you should not be fearful and to ask those governors with big facilities that they are not able to manage. Because I know there are some that are huge. The governors are struggling. You can see their expenditure, 80% is on recurrent. So on development is minimal. And they are struggling with their facilities. Is to take the journey that Governor Professor Anyang' Nyong, together with the DG and the leadership and the members of parliament of this place have taken to put the interests of their people before their own interests. And I do not think we'll have a problem. If DG is a true son of this soil, my Director General of Health, it is in his own interest that that facility is elevated the soonest possible. So we'll work together to see to it that we complete that journey. I want to thank you very much, everyone who has found an opportunity to be with us today to launch this facility. And with those many remarks, I would like to declare the Kemsa Kisumu Regional Distribution Center officially launched. Asanteni sana.
Thank you very much, Cabinet Secretary. Let's applaud her once more. Our chief guests, Your Excellencies, governors, it's now my humble pleasure and honor to ask you to walk so that we may do flagging of some of the commodities that are leaving from the Kisumu Regional Distribution Center to the counties outside this tent. We may proceed, Chair, you may lead that we go and flag off deliveries to Vihiga County.
Medicine is we improve the confidence of the patient. Madaktari wako, dawa iko. Sasa
But you know, those are the kind of demeanor I have.
Sure. 2. Check 2. Check 2.
Tabasamu kidogo. Then yesterday somebody was just saying hi. I tried watching a hi. Oh, no, hi. Text. Oh, but they But then that was the story. That's what he was saying. And part of it, they say it's business, but nobody Like when
Yes. say, this is Trillion Entertainment. What a day. What an event. We are so glad that you got a chance to come.
Serefuma una ure utemarume kapeva tachiwana oneva imasa ikana muina utachiwana.
Yes, I would like to respond on the issue of tax. That's what you're asking about. And today is a good day that I'm here with the employers, that is the county government, and I'm here with the chair and members of the health committee, the people who ensure that funds or resources are given to the Ministry of Health. The conversation about internship is not just about posting. It's a bigger conversation about healthcare financing. That we must get our financing for healthcare right, so that then we can take care of all pillars of universal health coverage. What we have launched here today is to ensure that the commodities are available, they are assured. We have a pillar on human resources, and that's where the interns plug in. So, and for the record, interns have always had a challenge at the type of post. It is not starting with this government, it is not starting with me as the cabinet secretary. It has always been there many years ago. And Dr. Nikal is here, he'll tell you that this internship has been a big issue. So what is there for now, the reason why we are not able to post interns immediately, one is that we have to ensure that wherever they are going, they are able to get the training that they need to finish and get the license. For that training to be available, we need to have the internship centers adequately equipped for them to find equipment to use. We need to ensure the internship centers have medical officers and specialists who will supervise them. We need to ensure that health commodities are available that they will use during their internship time. So the last thing that we need to do then is to compensate them for their time during internship. In 2017, the KMPDU, Kenya Medical Practitioner Dentist Union, signed a CBA regarding their internship to the level that their compensation per internship is 206,000 per month. That includes a salary and allowances. For now, that is unsustainable. As a ministry, we do not have resources to post them. And the law does not allow us as a ministry to post when we do not have And the report that I did in the evening is that we are going to continue to have another discussion, and for now is to ask the interns to be patient as we make plans to ensure that they are posted. If they went to a strike, who will suffer? It's the common Kenyan, the patient. So I want to seek that they be patient as we work together, and the solution that we are going to agree on is not by the ministry. We are not going to prescribe a solution. It's a solution that they are going to participate in, a solution that the county governments, who are the employers of doctors, are going to participate in, a solution where the national parliament is going to participate in, a solution where Treasury and other stakeholders are going to be part of it. So it's not going to take long. And even the Ministry of Education and the universities that are channeling out, because we want to ensure that we have a proper view and management from production to deployment as interns. So we have a plan and we know what to do. I hear some of you saying we are clueless. I know what to do and I have a plan on how to do it.
Just to put on what the Cabinet Secretary has said, from where I sit as the chair of the Health Committee in the National Assembly, together with my colleagues here. One, we need to look at the training of our doctors in this country, because apparently universities are channeling huge numbers without considering where they are going. Universities must be able to be regulated to train the number of doctors that are required within the market, because it is becoming a huge business for them to train doctors and not knowing where they are going. Two, we have all level 5 hospitals. In the past we had, when we were training interns, we were posting them to mission hospitals and also private hospitals like Aga Khan. And Aga Khan was paying their interns. Private mission hospitals were paying their interns. So we need this conversation around. It should not just be that it is the national government that pays the interns, because these interns, wherever they'll be working, they are also working for those hospitals. Can we have a conversation around all the internship training centers so that you have enough spaces, and those institutions must also pay for those interns? Because if an intern is coming to work in a mission hospital, or even Nairobi hospital, or Aga Khan hospital, then that hospital must pay for them. Today you ask yourself, there are hospitals who are not taking interns, yet they have the facilities that they could train these interns. And after the interns have completed, they are going to work in these institutions. So we want to, all these are huge conversations that we should all of us be able to discuss, agree. As we speak today, tomorrow at 2:30, there is a petition that has been brought to Parliament by the interns. And they are not just about internship alone. One is internship, two is on matters pertaining UHC workers who want to be absorbed by the counties on permitting the police brutality on their Secretary General, which we all of us condemn, because that is not how government works. We should not be able to harm anybody, because this country, we are constitutionally mandated to picket in whatever form that we should. So we will be able to look at that petition when it comes, and we think that with that petition we will also invite the Cabinet Secretary, we invite all the stakeholders, so that we can have a roundtable discussion and agree on what's the best way for us to resolve the matters pertaining to internship training in this country.
If I may say something, which then serves as furthering this conversation. Now, first of all, training is a national government function, despite the fact that health is involved. And I can hear here a view to the effect that we have so many medical training colleges, which is true. I mean, universities that are training doctors, so to speak. But those medical schools, to ensure that the last component of training of the medical doctors who have graduated is taken care of. Dr. Nikal, you know that. So it does not matter whether you are 70 or 100. Now, if we are 3,000,
you can see the
we must
conversation.
plan.
Now, I must say something. The basic thing with internship, the doctor is working. If you do not have them, the hostels where they work, it is just that it's when you qualify and get a degree, you go and work and get the experience. So the person is working. So wherever is working, there's need for payment to be done.
Yes.
And the only thing I will say is that we must also broaden. As he was saying, before it was only what was called provincial hospitals that were training interns. Then we had to open. Mission Hospital had to come in. Huge private hospital had to come in. I think that if you look at all level 5s, ideally a properly functioning level 5 with 4 consultants should train. So we must say, I know, let's not think so much about who is paying them, but where will they get the positions when they come out to work? And they treat people in most places when by the middle of the year, they're doing all the Sicilian section. If you remove the interns from doing Sicilian section, Dr. Mule, they would. So they are working.
Waziri, there's one question here. Waziri, the chairman addressed a very important question here about the
I thought you didn't have questions.
No, we have. We have this issue of 3.2 billion, which is owed by the county governments to Kemsa. Could it be one of the reasons which is affecting the supply of essential drugs? Because some of the governors actually raised the issue here that when they call for supplies, then you do not supply them with essential drugs. Could it be because of the reason that they are not paying also on time? And then secondly, you have been very passionate about production of vaccines locally here, but of late we have seen some of the manufacturers exiting. Is it because of lack of proper policies, or is it because of the high taxation regime? Then lastly, because I think you contradicted yourself, and the two members here of Parliament have been trying to correct you on this issue about training. We are talking about brain drain, currently witnessing the mass influx of exodus of doctors for other training, for other countries, to other countries like the UK. Even recently they called for Kenyan doctors that we can go, and those who have trained can go and work there. And you are saying that the universities should be regulated so that they only train to meet the deficit of the doctors in the country. Don't you think that is contradictory, and it will affect the training system?
I think to answer that, you did not understand. I said the university should train the number, you regulate it, to train numbers for the vacancies for which are available. If, for example, if we are talking about internship, what is the number of internship that we need? Because right now, you find that many universities are training, and it's a crowd of students. Some of that crowd, when you are doing a ward round, some of them are busy on their phones. They are not even listening to the lecturer on what he's teaching about that patient. And even when it comes to examining that patient, you have 500 students in the ward round. Do you think any patient will allow to be examined by those 500 students? It's not going to be possible. So you must be able to regulate what is the number of students that can examine a patient. You know, as a doctor, maybe I could ask you, if I was to examine even your mouth, and you are asked to open your mouth by close to even 100 students, will you be able to open that mouth for examination? You will feel uncomfortable, and yet you are there in the hospital to be treated. So that is what I'm talking about in terms of regulation.
But in terms of, let us not limit Kenyan professionals. I mean, quite honestly speaking, this guy who wants to train as an intern and gets, the required license to practice, maybe wanting to go and practice in Haiti, or maybe in Singapore, or anywhere like that.
Yes.
I mean, and they may want to go to private practice. Yes. So I think let's be honest with ourselves. We are training doctors. We license those universities. We must ensure that we have a plan and we have a budget to ensure that these guys do their internship to allow them to go and exploit their potential wherever else they want to.
The issue of supplies, the out of stock. Kemsa is just coming out of a very difficult time. Remember, we had the COVID billionaires that drained the reserves of Kemsa. So now the government is putting in measures to ensure that we inject in funds so that we bring Kemsa back to the standard where it was, to be able to meet its stocking levels. The 3.2 is outstanding, yes, but we have a working relationship with the counties. We have our officers from Kemsa who are always with the counties to seek them to meet their obligation. So it should not be a big issue, it does not stop us. But just last week, the government made an injection of recapitalization to Kemsa of 2 billion Kenya shillings. That is going to ensure that then they stock up on essential supplies and increase the stock level, level. Thank you.
Thank you.
The rest is
The rest in the bottle.
Sasa hiyo ingine unajua tag. You know the bigger problem. But the bigger problem for me is not the number, but answer for your problem. Because get it right. The problem is most doctors during the training, there are so many.